What causes bumps and bruises after injectable lip fillers?
When I discuss lip fillers with my patients who've never had the procedure done before, they sometimes express a concern about having visible bumps on their lips after treatment. A common belief is that bumps that appear on the lips are related to the type of filler used. In my experience, the appearance of visible bumps has more to do with the technique rather than the brand of filler. I'll explain the common causes of bumps after lip filler, how it can be avoided, and how lip filler treatment can be done more safely with natural-looking results. Lip filler is a very popular non-surgical treatment performed by various medical providers, including non-surgical MDs, physician's assistants, and nurses. It's common for injectors to demonstrate lip filler procedures on social media platforms. I recognize that many of these providers repeatedly pierce the delicate lip tissue in a way that can contribute to both bruising and the formation of bumps. Although bumps and bruises can occur with any method, I've developed ways to minimize the risk of these issues to occur for my patients. When patients who've had lip filler performed elsewhere and come in for revision of their enhancement, I begin with first recommending that the bumps and some of the existing fillers be dissolved. For hyaluronic acid fillers, I use the enzyme hyaluronidase. I usually recommend that the patient wait 1 to 2 weeks before coming back for me to then perform their lip enhancement. As with other cosmetic procedures I perform, I believe in enhancing the lips in a way that looks proportional and in harmony with the rest of your face. This means that if you're a younger person with genetically thinner lips than you'd like, or a middle-aged to older person who's lost volume and definition due to facial aging, nature has already provided us a framework for me to add volume strategically for a natural appearance. Although I do use needles for filler placement, I generally prefer using blunt-tipped cannulas instead for lip enhancement. This approach allows me to significantly reduce the number of times the lip tissue is poked with a needle. I find that use of cannulas prevents trauma to blood vessels, which occurs more easily with needles. Needles can cause bruising and even cause fillers to be placed directly into a vessel, resulting in important vessels being blocked. This is referred to as embolization, which can be catastrophic and very complicated to treat. When mid-level providers like nurses and physician's assistants have a problem like an embolization or vascular occlusion, they have to emergently refer to expert doctors to help them. Unfortunately, time is very limited and permanent tissue loss and disfigurement oftentimes occurs before a higher level of care is consulted. Thankfully, these types of events are rare. After I place lip filler, my patients can immediately appreciate the improvement with the understanding that some swelling will be present due to anesthetic and tissue response to manipulation. As I mentioned earlier, my aesthetic is to focus on the preservation of proportion and harmony of the lips with the rest of your facial features. Generally, the proportion of the upper to lower lips is a ratio of 1 to 1.6, also known as the golden ratio. Another general rule is a proportion of 1/3 to 2/3. Adjustments are also made according to genetics and ethnicity. Although some injectors and their patients prefer a more exaggerated aesthetic, I find that my patients prefer to look like themselves, but with fuller lips and more attractive, natural-looking lips. So in summary, minimizing the risk of bumps and bruises, having a safe procedure, as well as enjoying natural-looking enhanced lips, it comes down to the expertise and aesthetic of the doctor you choose. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.